A very good evening to all present here today celebrating mental health with us. As one of the closing events for the MH360 event, we have a very powerful session over here, and we have Kavita with us to um, help us get on with that journey of understanding how can we give back the power to the community. When we talk about mental health care or disability rights for that matter, it's always a sector of mental health professionals, disability scholars who are constantly raising the same conversations again and again. At what point are we going to give the power back to the people from the community? And to emphasize on the voices of these communities, we have Kavita Nair here from the Bapu Trust. So, welcome Kavita to the panel, to the discussion.
Thank you so much, Reshma. Do you mind if we switch places so I can take a look at the PPT?
Certainly.
Thank you. Hello, everyone. Uh, so, giving power back to the people, community based mental health care in India. I will be sharing a bit about Bapu Trust and its journey in doing community mental health work. We started in 1999, and the organization was founded by Dr. Bhargavi Dawar. We work in low-income communities of Pune city. Our signature program, SEHER, it's called the Community Mental Health and Inclusion Program. It's a service implementation program which works in low-income communities. The program has an outreach. At its best, it had an outreach of 8 lakh population, reaching 30 slums. The program also scaled to Madhya Pradesh and Chhattisgarh, and currently Bapu Trust is working with 11 organizations replicating this program in other states, 2 other states of India. So these are some, just some numbers how far the program has reached from one slum in Pune city to a number of villages, rural settings, semi-urban, and urban settings. Next one. So when we started when we started working, in our direct service implementation program, we were a typical mental health service provider. What does that mean? We had a top-heavy pyramid. So who were the people who were the service providers? They were experts who were formally trained to deliver mental health interventions to people who are coming to them for services. The approach was very individual. So somebody comes to me and tells me, okay, I am not able to sleep. I have these so many thoughts and, my heart is pounding. I am not able to step out of the house. So the service provider will work with the person and offer certain very specific kind of mental health interventions as a part of the service package. The outcome that is expected in a setting like this, it's a clinical setting, is that the person will recover, feel better, learn some coping skills. And it was, so when we were doing this, we were working in low income communities. It was very challenging to do this. One, because the mental health was not a priority for somebody who's the sole breadwinner of the family. They don't have the time to come to the clinic, engage with a therapist, go through talk therapy, miss a few hours of work. There were people who were malnourished. There were conflicts happening in the family. There was migration, there was displacement. So a lot of social factors were in play, which we were not looking at in this approach that we had at that time. This was many years back when we started doing the implementation program. It had very limited outcomes. So the outcome would be, I am feeling better. I am feeling slightly okay. For those of them, who came and who did use our services. And the outcomes would answer the question, what can you do to treat the person? So you can offer counseling services to the person, you can send the person to a psychiatrist, or you can do some kind of a specialized therapy, and you help the person, or you try to help the person to recover. These are the 4 or 5 outcomes which is possible in a design like this. It has, of course, a number of implications for psychosocial health and well being, because the social determinants which are affecting mental health day in and day out are not addressed adequately within this kind of a program design. And to give you an example, a mental health response would be alleviation of symptoms. It is individual focused, recovery based. For example, we can treat anxiety. Next one, please. So then, we really, this got us thinking, because people were, one, not coming. Second, those who were coming were not, they were really, we were not able to have very great outcomes with them. Third, it didn't seem to be a rights based framework because it gave very limited choices. If you give me only two choices, you can go for talk therapy or you can go to a psychiatrist. That is really not choice in its true sense. And we had nothing to offer to people to address the social determinants of distress. At that point, our founder, I think, and the board, and people who were working with the Bapu Trust, we got together and we started questioning this model that we were operating with. And we did feel very strongly that we needed to invert the pyramid. So the pyramid should no longer be top heavy, it should be bottom heavy. Secondly, it should not be an individual approach, it should be a community approach. It should not be recovery oriented, it should be support oriented. And there should be easy availability of support people, not only formal service providers, but a whole range of informal and non formal networks and support people. We needed to respond to social determinants of distress. We needed to move beyond working in silos, working in isolation. We needed to open our doors to collaboration and partnership with other community based organizations, other NGOs, a whole lot of other stakeholder groups who were there in the community ecosystem. Who will do this? Bapu Trust. How will we do it? Will it really have any impact on communities? So then we said, let's try and see what happens and what works. So again, just two examples. So the initial one, the first slide before this, is a typical mental health response. When you have a psychosocial response, you're looking at the experience of distress. Where is this person's distress coming from? What is the stressor? How many stressors are there? Can you do something to address the stressors? What are your mitigation strategies? For example, if you look at the top one, you are responding to anxiety. If you look at the bottom one, you're responding to possibly somebody who's lost their job. Maybe this person is going through violence at home. Maybe this person is grappling with breaking relationships. So how we understood distress also changed when we started reframing our own questions. Next one. So then, to answer the last, who will do and what impact it will have on communities. Very, very progressive and radical steps were taken by the Bapu Trust leadership and board to give power back to communities. It's not easy to invert the pyramid. It's not easy to take power from an expert-driven model and give it to a community-driven model. We wanted to, and these steps enabled us to go beyond health, go beyond treatment and care, go beyond an expert driven mental health model, and it reframed our understanding of what was needed. So we moved from asking, what can we do to treat you, to asking, what can we do to support you? What can we do to include you? We don't know. Show us how. What do you need? Where do you want us to come in? Where do you want us to step out? Will Bapu Trust and the Bapu Trust resources, are they the only people who will respond to you? Or are there other people in your ecosystem who can respond to you? So we moved to a grassroots model of working where we started investing and exploring with huge and multiple cadres of non-formal and informal networks. What role were these non-formal and informal networks taking on? They could be caregivers, they could be support persons, they could also be service providers. We wanted the community based approach to be a doorsteps approach, not a clinical approach. So you come out of the community, you go to a clinic and you meet an expert. No, the service is right there in the community. It is available to you at your doorstep. And for this, who will do this? There is role for multiple stakeholders in the community, in the family, in the neighborhood, in the peer group to be able to take on different roles, support roles. Next one. So some examples, what do we mean by all this? I mean, how do you practice it? Actually करना क्या है वहाँ पे जाके और कौन करेगा? So to give you some examples, we started working. One, we hired local people from the community, trained them, built their own skills to respond in a supportive way. And these are people who are there, who are living in the community. For them, it's not a 10 to 6 job. They are there even as peers, day and night. And if somebody needs support, these people are accessible because they are staying locally in the same neighborhood. What can they provide? So these are all things which we have done and we have seen that it works. Low income communities have taught us that they are very, very altruistic, very, very open to giving a lot of different kinds of support. So there was somebody in crisis. He was a wandering person and we got in touch with him. Somebody actually referred this person to us. We worked with another family in the community who was willing to give shelter to this person and who said that, okay, till we find the family of this man who's wandering, this person can stay with me in my house. And it's a small, chota sa room with 2 people staying already. But they were willing to provide foster care. 2, when somebody is in crisis again, and crisis I am referring to again and again because that is usually when service providers feel a need to rush in and intervene. But there are community members who are willing to provide food, fluids, safety. There are peers. You can build caring communities, caring peers around the person. Friends, volunteers. These could be youth leaders. These could be women from the self-help groups. Neighborhood lookout systems. When there is conflict, when there is violence in the family, the community around that household will be sensitized to step in to address the violence and to curb and stop the violence. The person who is going through the violence is able to step out of the house and go and find a safe space, perhaps in a peer's house, a neighbor's house, anywhere in the community or in the vicinity, which will allow them to be safe, be away from the perpetrator. When there are people who are wandering in the community, there is a route that people would usually take. So you set up lookout systems for them, because and these are the people who will offer them chai. They will offer some biscuits, maybe sandwiches. Ensure that people are not beating them, calling them names, laughing at them, mocking them, teasing them. So these are some of the things which the neighborhood lookout system would do. Also to ensure that the police doesn't pick up wandering people and put them into institutions. When they notice that, okay, here is the police who's coming to pick up the person, the community volunteers are mobilized and groups of people will reach that spot and start working with the local police over there. Then there are peers, volunteers, again neighbors, who can engage with the person to do self-care exercise, just being with the person, offering companionship, offering time, sitting together, going out together, giving information, assisting with moving around the community, negotiating with the family, supporting in crisis. Every crisis passes. And I think crisis, what we have seen is when somebody is in crisis, that is a time when participation is most restricted. You are either locked by your family, or you are put away, or some kind of a policing system by the family or others start around you. They take control from your hands. So during crisis, many people will be mobilized around the person's in the person's ecosystem. One, so that the person's choice is and control is not taken away, and there can be people who can be available as required, when required, touching base with the person and asking them, what do you want right now? What should we do? What should I do? What should I not do? Next one, please. Yeah. So, working with the communities involves engaging deeply with the families, with neighborhoods. What we are essentially trying to do is, so if you look around you, who is community for you? Who is the closest community you have? Family, friends, teachers, classmates, maybe workspace, peers. We all have communities around us, and these are incredible resources. So we work with communities and we enable people to build social capital. What do you transact in these networks? You transact emotions. And so the outcome that we are looking at is to build psychosocially resilient communities by working with many kinds of stakeholders. It involves, of course, building capacity of stakeholders. It's not easy because we think we know how to care, but sometimes and many times we don't know how to care in a way which is dignified for the person, in a way which will respect the person, in a way which will give the freedom of choice to the person, in a way which will not take away control from the person. So yes, we build capacity of stakeholders to respond with care and support, and we work with ecosystems to build caring communities. And it's a mutual give and take. So it's never one way. Next one. We strengthen community processes for collaboration and not for conflict. So non-violent ways of responding, playful ways of responding, being with as a support response. And this is something that we do. Create a circle of care and support around the person. It's not a circle of treatment. It's not a circle of recovery. It is a circle of care and support. So that people are not only surviving, but they are thriving. And happy that I finished in time. Yeah, that's all. Thank you so much. So happy to have questions, reflections, also learn from you about your communities.
Yeah. Just adding on to what you said about communities and creating spaces, I'm by default going back to this beautiful paper by Judith Butler on vulnerabilities and resistances. How sometimes just being from a marginalized community, any kind of visibility that you have can be seen as a threat, and thus even to exist in that community you need to resist, and this resistance can be everyday resistance. So for someone who's struggling with some kind of psychosocial concerns, this individual just getting the normalcy of going to work, sustaining a day-to-day life itself could be everyday mode of resistance. And by default, we are living in a society where any kind of resistance is often putting the person who's resisting at a position of vulnerability, right? So I think something like a community-based approach also decreases the amount of threat that this individual feels. The onus is somehow taken away from this individual, and that's a very essential bit of this model. Um, any comments, questions regarding the community-based model? Yes, we have a question over here. Yeah, one. We'll just come to you. Yeah.
Hello. You mentioned that you're working with people in the community, not just formally trained therapists, but also peers in the community to help support people who need mental health care. My question is, how when therapists undergo formal training, there is an emphasis on do no harm, that even you might have noble intentions, but inadvertently you might project your own judgments onto them, etc. When you are involving volunteers into the picture, how do you ensure, or do you have safeguards in place for ensuring that they don't do anything that might exacerbate the situation?
Yeah. Thank you so much, Banu, for that question. Yes, I think we have great potential to do harm, all of us, and unfortunately so. But yeah, so because our grassroots are locally located, one is they are constantly working with the volunteers or the peers. Second, so this is one of the safeguard. The other one is that many of the volunteers are people who have actually benefited themselves and who are now wanting to give back to other peers who are going through the journey. So then these are not, so the selection of these volunteers again is with, in consultation with the person. Who would you like to have around you at this time? And so then the person would identify some, a couple of people around them. Some of them may be family, some of them may be peers, some of them might be just some youth leaders, women leaders. And then so we reach out to those individuals, and we set up certain things which can be done, but we also call out what are the things which should not be done. And there is a constant dialogue going on with the ecosystem, uh, again in consultation with the person. Yeah, so these are some of the safeguards, and the community usually have their own safeguards in place. So I think sometimes we also tend to overthink as a service provider, and I have been there and I have gone through that, where I don't trust that this person will be safe in somebody else's hand. So, but I think I really need to step back and question where that is coming from, because unless I am willing to trust another stakeholder and make space for them to contribute, I will not get very far. And really, it's not about me. So, thank you.
Thank
I
you.
hope that.
Yes, that does, yes.
Hi.
Just just adding to that question, actually, that's also seen as a very significant reason why there is this constant division between persons from the community and us, the other category. So as long as we are holding on to that binary view of us and them, I think that difference in understanding is always going to exist. So perhaps conversations, open conversations with the community members is something that will help a great way.
Absolutely. And we ask community members कि इनके घर पे वायलेंस हो रहा है, इसको रोज मारते हैं ये, आप क्या करोगे इसके लिए? So then we don't go to tell them कि आपको क्या करना चाहिए. First, because I'm sure everybody, there will be somebody who will say कि violence नहीं होना चाहिए और इसके लिए ये चीज़ें कर सकते हैं. So then to be open to receiving those inputs and telling them, wow, great, so let's do this together. So yeah. Ma'am? Transacting emotions is basically, as humans, how will you connect to each other? So you are together in joy, you're together in sorrow. It's not that you're only together in sorrow. So then, and sometimes you're neither together in joy nor in sorrow, you're just with each other. and then you respond and you speak to each other, you connect with each other as you would connect to anybody, on a day to day level. And I think it's so important to give emphasis on that, because you remember that first slide which had the X mark on one person and who was like away in one of the visual. I think we mark the person and the conversation start becoming of a different nature. You're okay, no? Everything is all right. Do you want me to? These are not normal conversations. So when we say transacting emotions, it's like day to day level pe jo conversations hote hain. A give and take of, okay, you make me feel safe. I can also offer safe spaces to you. You listen to me. I listen to you. Sometimes you don't listen to me. Sometimes I don't listen to you. So a whole range of things that we experience as humans. I think making space for that without getting in each other's way.
We had a question over
Hi.
there.
Actually, I
Then we'll
don't
come to
have
you.
a question. I just wanted to share a reflection. I just wanted to share a reflection and
Sorry,
the
I couldn't.
gratitude. As I was listening to what you were saying, and I think such a paradigm shift and so fundamental. And I just want to share something personal. I'm not from a marginalized community, but I think that this community-based model, like for instance, what you shared about the neighborhood network of different people who are sensitized. So because say I mean, if I'm when I'm going through abuse in my house, I'm so isolated, and at that point, I don't know where to go, who to go to. It's not at that point that I'm going to reach out to a therapist, even go to a police station for that matter, because
Yeah.
also it's happening at an untimely hour, or
Yes.
it's a daily practice,
Yes.
or something like that. And there is a sense of isolation, and you don't know where to reach out. So I feel like what you're sharing and a community-based model is might be applicative beyond marginalized communities also,
Absolutely. Yeah.
and the other thing is that if it is not a community-based approach and it's only individualized, there is so much of labeling,
Yeah.
and then you're right, the dignity that comes, because the whole you stand out always
Yes.
as somebody who needs treatment or somebody who's going through something. But
Yes.
so I just wanted to share this as a personal reflection, really inspired and touched by what you shared and the model. And I do think it's applicative across, not just in marginalized communities.
Thank you so much. Yeah. Thank you.
Ma'am, I had a question. So, firstly, good evening. Uh,
Good evening.
so basically, I have classmates who have or who are suffering from a lot of mental disorders. Like I'm doing my master's in psychology. So when we are sitting and they're talking about, okay, I have epilepsy or I have ADHD, I have depression. So I have seen the kind of, I don't know how to react. Like I cannot sympathize because I'm studying like you should not be sympathetic but empathetic. So how to, and we're talking about community care. So they are my peers. In a way, in future, if they might need any help, so I generally end up dismissing when they're telling because I don't know how to react. I end up switching the conversation, or I don't even like what to say, what to do. What if I end up saying something that they may feel I'm being sympathetic, I'm victimizing them, or they might. So what could be a way like me as a peer could provide a safe community for them if in case they need any kind of support.
What would you like to be in? Let me ask you this. So, suppose you are in this space where you are going through an experience of distress. What would you like your peers to do?
I would just want them to listen first.
Yeah, just do that.
Like what kind of reaction, because I feel like I am very neutral. It feels like I'm dismissing them, I'm ignoring them. I personally feel that, like if they're sharing something, so I don't know how to react. Like
Uh, yeah, no, I'm wondering what to say, because has anybody told you that they feel dismissed by you?
I can see the expression at times because I switch the conversation.
You can see their expression. Maybe ask them, are you feeling dismissed by me?
That sounds better. Thank you so much.
Uh,
If the listener doesn't give any expression, then it feels like you're speaking to a wall. Then it's not a empathic listening. Why not to express sympathy? I'm rather asking this question. Why not to
Yeah,
express
no.
sympathy?
So I am not saying ki express, don't express. I'm saying nothing of that. If somebody is reaching out to you for support and you register that this person is reaching out to me for our support, then please ask the one is tell the person that, I am available here. I am able to support you. Tell me how do you want to be supported. Ask this to the person and they will tell you what they need you to do and be willing to do it. Be willing to do it. If there are things that you cannot do, ask the person, okay, this I cannot do, but I know somebody who can do this. Do you want me to connect you to that person? And they will tell you what to do. So I think
Are
these,
not we supposed to give insight, conceptual or philosophical insight? I mean, we are not going to earn money for the client. If someone is poor, so we are not going to beat his or her enemies. It's just verbally we are consoling or giving insight to the situation. Isn't it enough?
it depends on the person. If they're looking for insight and if they're asking you, ki, yaar, please help me to understand this situation,
Yeah.
then yeah, you brainstorm with them. Ki, okay, look at both angles. Ki, this also happens, that also happens. But I think when we talk about giving insight, often it is our assumption of what is insight. So we have to be careful what we are saying. And I think I would want to know exactly what do you need from me. Okay, you want to talk about this thing happening in your life. All right. So let's look at this from different angles. What's happening, and let's try to make sense of it. And once we talk about it, I could maybe ask the person, so what do you feel now? And it has to be their insight. It needn't be, and I don't think it should be my insight or something that I should be providing because it puts me in a position of power, and don't want to be there.
Isn't it little political? Actually,
It's
the
not.
no,
It's
no, no,
not.
no. Why? I mean,
It's
it
ultimately
depends.
giving the power back to the community.
Yeah, that's
Absolutely.
fine. That's fine. But someone who is coming to us, we are supposed to be wiser. I mean, it's a mutual dialogue. That's fine. But we need to facilitate that insight to happen. And for that to happen, we need to engage the client to some kind of deeper interaction, philosophical, psychological exploration of what is happening. And what is wrong if that process involves expressing sympathy for the suffering of the client?
There is, I think, if we are able to play the role of a facilitator, great. Whether you want to be sympathetic, whether you want to be empathetic, it is really up to you. And it's really up to the person who's coming for support. For me, I think I would always ask the person that, okay, is there, so if I am a person with a lived experience, I don't find dignity in a conversation, I would choose not to have that conversation. I'm better off not speaking to the person where there is no dignity in that conversation or that relationship. And different people have different ways of responding. And when we are talking about giving power back to the communities, this is what I understand. And the way somebody else would work would be very different. And that's fine. As long it's working for the person, it's great. It's really up to that person to decide. So, yeah.
And often enough, when our friends, our peers are asking us or sharing something so integral with us, it's mostly a matter of just giving your ears. Active listening is a crucial part of that journey. And they are also aware of how you are understanding their experience. When you are going to approach them with a sympathetic lens, they are also aware of how you are creating that power hegemony of putting yourself up above them. So are you really maintaining an equal position while philosophically giving them an insight? Aren't you already establishing that I know better than you? So often enough, it's just about hearing what they want to tell you.
Yes, sir. Band hai mic.
I had a question which is based on some stats. Like in India, that stats is of 2018 of Health and Family Welfare Organization, Department of Health and Family Welfare, that only one psychiatrist is above, on a contrary or a ratio on 2 lakh people in India. And still in India, like last month, I'll say we had a breast cancer awareness month. And I was having a conversation with some of the patients who have recovered from breast cancer. They were having a very traumatic experience, and some were very severe cases. Some were like, still there are some recoveries that are happening, and still a lot of people are dying in rural areas. And when we are talking about healthcare, which is so unique that a lot of people on this debate will say that you don't need healthcare, because actually when we say about Ayushman Bharat, which is actually there on grassroots, we see the funds which are allocated for Ayushman Bharat on chronic disease is so low that you can't even afford to go into a private hospital. And I was just willing to know that how we can reach to people on certain issues, some basic issues, that some level of awareness, because everywhere a psychologist or a psychiatrist or a social work person can't be there. So how we can sensitize people? First, we can obviously do it in school classrooms, because some place it starts from the very beginning, the grassroots. And the other question is how we can actually reach to the most marginalized section of the society, like people who are in rural areas or people who are from very low socioeconomic status. How we can reach them?
Yeah, so my first, I don't know how we can reach, all of them. I wish we could. Um, um, One is whether a psychiatrist or a psychologist is or even a social worker is needed everywhere, because communities are everywhere. You just look around you, you will find families, you will find schools, colleges, and that is a big community. And they have strengths, they have their intrinsic resources. So if we can find some way to, work with those communities which are already there in place, then a lot can be done. You needn't really rely or wait for a psychiatrist or a psychologist or a social worker. So you invert the pyramid. Yeah. You invert the pyramid. Build non-formal, informal cadres of support networks. Second, how do you reach to the most marginalized? I think many of us here today are looking for many kinds of answers and responses. So we go out there and we work, we collaborate with each other, we partner with each other, we partner with the development sector, and we partner with the government. Government has huge machinery to scale any kind of a service or a support system. So these are some practical ways of doing it in a program. I don't know if that helps, but these are some things I could think of.
Any more questions? Comments? Yes.
You just spoke about government support. If you could just give us a small understanding of, is there enough government support at this current time, and if so, what is there?
So when we work in communities, we partner with the ward office, we partner with the general hospitals, the public hospitals, which are close to community settings. We partner with all these government institutions, naturopathy, Unani, Siddhi, all of them. And we go and ask them, what can you do to include this person? And they are able to tell us what they can do. So we local government, definitely reach out to them. They will be more than happy to collaborate in one way or another.
Okay. Okay.
So yeah.
Thank you so much.
In fact, I think in South, even palliative care centers have been of massive help.
Yeah. Absolutely. And there's a lot government can do, housing, pension, disability pension, entitlements. There's a lot actually that the government can offer.
Hi, my name is Rain, and I have been working in the communities from long time, and specifically last 1 year I was in Delhi working in Govindpuri community where I was working with young people, and right now I'm placed in Ajmer and in a very rural area. What you were sharing and I was listening and I feel connected to that one, the
emotional stress of any place is very complex. So we can't even define them in the boxes. And I don't really believe in the putting all the feelings in the boxes. And second, I personally experience within 5 years or 6 years of working that community, they have their own mechanism of dealing their mental health. For example, I was working with domestic violence of women. So they are there in a process of violence, but there will be the next door women who help her in her house chores. So are we really talking about the systematic and the approaches that we are therapists and we are practitioners, so we know the best? But the community itself, they know the best. And the power you spoken about, it was amazing to hear that we comes from an approach of somebody like look different from the community and they see that power and they believe what we say. I also see that in a positive manner as well, because power is always not wrong, and I always believe that that is also one kind of a space which we bring together. But however, overall my experience is like I have heard more examples and more solutions from their own stories than what I was bringing over there. Yeah, thank you so
Thank
much.
you so much for sharing that. Thanks a lot.
Okay, I think closing the session with that. Thank you so much, Kavita, for being a part of this session.
Thanks a lot, Reshma. Thank you, Red Doors. Thank you, Aparna. Thank you, Ayushi. And thank you all. Thank you all for being patient and just having this conversation. Thanks a lot. Okay, bye bye. Have a good evening.